Right, okay. So I don't know how many of you I virtually met this time last when I did the last webinar for you, but I'm going to introduce myself again in case you don't know who I am. So I'm Angela Wright. I am a jack of lots of different trades. I'm a GP by my original training. I worked in a hospice for about 10 years. And then, I don't know, 7-8 years ago, I trained in something called clinical sexology, which, as I explained last time I was here, is a real job title. And it means that I am trained in psychosexual therapy, so a 2-year psychosexual therapeutic diploma, and then the medicine bit of that afterwards. So I've been to the ESSM Advanced School of Sexual Medicine and sat the membership exams to join the European Committee of Sexual Medicine. And what that means is I've got quite an unusual amount of information and knowledge about sex for a doctor, because they don't really teach us a lot about it. And because they don't teach us a lot about it, it means that there's not a lot of practical help sometimes when you get problems with how sex is. So I was really pleased to be asked to come and do the webinars. I work at the Wilberforce Centre in Hull, which is pretty much the patch for probably many of you watching, but I'm a BMS accredited menopause specialist and work out of there once a week, but also work in North Yorkshire and online. And most of my day job is spent talking about women's health, menopause in particular, and issues with sexuality and sex. So that's what we're going to talk about tonight. And I'm going to talk specifically tonight, we're looking at the psychological impacts of going through menopause. So we're going to cover, and I think one of the problems I have with doing slides for something like this, or I always get when I'm doing a presentation on something like this, is how on earth to talk generally about what happens in your mind to individuals, because it's going to be really different for every woman that's going through the menopausal transition. But some of the broad areas that affect most people include issues with, how your body's changing and how you feel about that. There's often problems with anxiety, low mood and stress. I think, lots of us go through menopause and perimenopause in our 40s, and lots of life stuff kind of coincides together to make that a particularly challenging time. There's issues with sleep disturbance. We often develop anxieties around sex, which can be a bit like a performance anxiety, which can make things even more difficult. And then I'm going to try to talk a little bit about things that you can do to overcome that. So we use the word mindfulness all the time. It used to sound like something that I thought was nonsense, but through my training and through the sort of work I do with people, it's got really good applications, and it's really helpful in the stuff that we're talking about tonight. And to always say, just a note on language, because I never know when people are watching a webinar like this whether actually they might have been assigned female at birth and then transition. So I use the word woman, but I'm covering non-binary gender, and I'm focusing on problems, but not everybody's going to have problems at menopause. Some people find it quite a positive experience. Some people have said to me, don't be so negative about it all the time, and I'm kind of mindful about that as well. So I use this word biopsychosexual is what I've written on here, but I mean biopsychosocial. I use that word a lot, and that is because when you're talking about issues with sex, it's not useful just to talk about what's happening in the body, even though what's happening in the body is incredibly relevant as we go through menopause. So this is the idea that it's kind of a Venn diagram of physical changes, psychological changes, and then all of the changes in our relationship and in our world. And sex plays out in all of those kind of places in our minds and in our lives. So problems in one area tend to start spilling into other areas too. So the last webinar that I did talked about the biology of what's happening, and I'm quite happy to answer questions about that afterwards if people have got specific questions about it. But menopause marks a really fundamental transition in our bodies between having plenty of sex hormones like estrogen and progesterone and testosterone in our bodies, and then the period postmenopausally where those hormone levels are much lower. And that has direct impacts on the skin and tissues of the vulva and the vagina, and how touch feels there, how well we lubricate, whether we experience pain or pleasure with sex. Also impacts things like our bladder and our continence sometimes. And it can affect your brain and how you feel generally in yourself. So those physical changes will impact on sex. We also go through lots of changes in how we feel in ourselves. So when I talk about psychological changes, I'm really just talking about how you feel in yourself and your sexual identity. So we're going to talk a bit tonight about something called sexual scripts, which I'll explain what they are shortly. A little bit about emotional well-being and the things that can throw us off track, like anxiety and stress and so on. And I'm going to try and give some pointers about how to tackle the issues of your body changing and how we can feel about that, and how we can lose confidence as we go through this stage, and it can impact on how sexy we feel and how sort of confident in ourselves we feel. And then tomorrow, we're going to look a bit more about the social impact. So this is all the stuff about our sexual relationship, what makes us want sex, how does libido work, what happens in long-term relationships, what happens in new relationships, and some of the sort of societal, cultural messages about sex and aging and things. So your sexual mind. So I was always taught that when it comes to sexual function, it's built on four main things. It's built on our sexual function, which is all the bits of our body that are designed specifically to let sex happen. So desire, arousal, climax, kind of genital function, the nerves and the blood supply that work there. The body generally allows us to have sex. So that's kind of our joints and our comfort in moving, and whether we've got, enough saliva, a sense of smell, good sensation in our skin, whether we can move comfortably. Our sexual relationship will impact how sex feels, but tonight we're talking about sexual identity, this concept of being a sexual being. How does it feel? How do you feel about yourself sexually speaking? And when I was training in sexology, we do quite a lot of experiential stuff. So they make you think about your own sort of experiences, and it helps a lot to do that, actually, because I'd never really considered any of this stuff. And we start with talking about sexual scripts, which is scripts to psychologists are the absorbed truths. It's the stuff that we just sort of absorb without being necessarily taught directly, and it becomes our model of what is normal. So sexual scripts in particular are the unconscious ideas that we picked up growing up about what makes for normal sex, what makes for problems, what makes for, normal behavior, bad behavior. And we take it in from our family of origin. So whether or not we've grown up in a family that talks about sex quite openly and, considers that pleasure is something that we can seek and it's okay, or whether you've brought up in a family where sex was kind of hidden away and nobody spoke about it. We learn about sex at school. We learn about it officially through sex ed. I think I got about 7 sex ed sessions at school because they transitioned from teaching it in the 3rd and 4th year, so we got taught twice. But some children don't have access to good sex education at school because they may have been held out from having access to that, and that can mean that we don't have a good working knowledge of what sex is, how bodies work, how relationships work. So this stuff happens a lot better now in schools, but when some of us were growing up, it was more hit and miss. Our traumas, 1 in 4 of us will have gone through some form of sexual trauma, and our first experiences, whether they're good or bad, that can impact how we feel about sexuality in our bodies, and it can continue to impact a long way into our lives, particularly if we've never dealt with those things. And I see quite a lot of women for whom trauma is the thing that's coming up for them around menopause. It can sometimes some of the crossover symptoms like palpitation and anxiety can really heighten trauma symptoms for some women. And we absorb a lot of stuff from film and TV, from religious and cultural messages. And you've got to think about the kind of messages that we receive. We don't often question them, but we see lots of young people having sex. We see lots of heterosexual sex. We see lots of passion, high passion sex, rather than the kind of sex that most of us will be familiar with in a long-term relationship, which happens in a slightly different way. And it talks about monogamy as being the sort of one and only way that people's relationships play out, and that it's really easy to be in a monogamous relationship and for sex to stay passionate and spontaneous and interesting. And most of the sex that we see will follow certain scripts as well. So it tends to be that it goes from kissing to some touching to penetration. And that becomes the model of what we all think sex looks like. And we don't often start to sort of break that apart or consider to question whether we should have taken that on board as being the one and only way that everything happens. And again, it's a bit different now that pornography is really widely available. Lots of younger people are learning about sexuality by watching rather than doing, and that has its own sort of pros and cons to it. But again, pornography doesn't look a lot like the sex that most of us have, and it shows orgasm as really easy. It shows quite a male focus on the sort of activities that would make sex up, shows only one sort of body type. So this all drips into us, and it forms the basis of whether we feel like we're okay. And one of the things that's quite useful to do in a sex therapy setting, or if you're starting to explore what's going on for you, is to pick out some of these beliefs and actually actively work out where they've come from, whether you actually believe in them, whether you've ever questioned them, and we can discard some of these things, and it can be really useful to do it. So some of the common sort of sexual scripts that I hear from people are that, men are normally the initiators of sex. Women tend to have a lesser sex drive than men naturally, that low libido is a normal state for us to have, that sex is only good if it's not planned. If it, one of my tutors said sex should fall from the sky, we think, but actually nothing else in our lives that's good, we expect to fall from the sky. If we go to a great restaurant, we know we need to book it in and plan for it. That sex drive is something that you can't work on, and that perhaps we naturally want less sex as we get older. And none of these things are actual truths. There are trends in these statements, but there are individuals and groups that will definitely not fit these boxes. And it's quite important to sort of notice where the stereotypes are getting in the way. So one of the areas where I find I come up against sexual scripts all the time with work is that I see lots of women that think that their sexuality is not working properly. They think their bodies don't work. And actually, this is something that's been very much absorbed, and it's to do with the kind of sex we have and the way that we think sex should look. So our society is very big on what we call penis and vagina sex. So this seemed a really alien term when I started doing sexology. I thought, well, what other kind of sex is there apart from, if you're talking about same-sex couples? But this kind of focus that we all have on penetrative sex as being the main event is something that it can be quite helpful to question, particularly when sex becomes a bit more challenging. And if you look at how an orgasm gap has begun in men and women, there's lovely studies that show that if we get women and men to touch themselves to climax, that 95% of men and women will orgasm in solo sex within minutes. That the figures are equal for male and female bodies. But when we look at what's happening in heterosexual relationships, men will orgasm 95% of the time in sex, and the number for women goes down to 65%. And in casual sex, hookup sex, the male orgasm rate is still really high, but the female orgasm rate's gone down to 18%. In same-sex relationships where women are having sex with women, the orgasm rate stays at about 85%. And a lot of this is because of what we think should be possible from penetrative sex. We often think that something's wrong with us if we can't climax from penetration, but the stats show that far less than 30% of women can climax from penetration alone. Usually climax for women is due to clitoral stimulation, whether it's the clitoris kind of extends internally for quite a significant way, but it's stimulation of the clitoris that usually leads to orgasm. And people have even studied the sort of hierarchy of how women will achieve orgasm, and we do it most easily with our own fingers, second most easily with partner's fingers, then a partner's mouth, and penetration's at the bottom of that list. So I see lots of women that think that climax is an issue, orgasm is an issue, something is wrong with them. And it's just these absorbed scripts of what sex looks like that has led them to think that something is wrong with their bodies. And also I think for partners sometimes to think that we are slow, or that we're not responding in the way that they might expect us to do so because of things that they're seeing. So most of the imagery that we'll have been exposed to is heavily youth-weighted. We'll have absorbed ideas about sexuality as we get older, or when we become mothers or grandmothers. We will have ideas about which bodies are desirable bodies and which bodies are less desirable bodies. So as the loss of estrogen starts to change our bodies, and our skin can get drier and it can get a bit more crepey or looser, or we might find that breasts can become less full, it's really challenging to embrace any of those changes when we are constantly bombarded with only one version of what beauty might look like. We don't have enough of a counter to that. It's difficult sometimes to feel your role shifting, going from being a fertile person to being non-fertile, or that door closing if you've had a problem with infertility, to become a grandmother, or to have your children leave home, and to question what your identity is. All of these things shift who we feel that we are in ourselves, and anything that shifts that will shift how we feel about sex. We're also sometimes challenged by, infidelity or relationship trauma, getting divorced, starting again, accepting changes in our body if we've been through illnesses, or surgery if we've been through something like cancer. All of this stuff impacts sex because it distracts us. We develop low self-esteem, we can feel shame feelings about ourselves, and it's really hard to be in a space where you're feeling unconfident about yourself and to have good sex. We're distracted by it, and we get worse sex satisfaction scores. So this stuff is really important. So in the most basic way, getting turned on or having sexual arousal happen within your body is described as being a bit of a balance between sexual accelerators and sexual brakes. We've kind of got, this sort of upping and downing of both sides of that equation. And when there's an issue with sex, it's often quite useful to start to ask questions, was it always like this? Does it happen in every sexual situation that I'm in? Is it just with this partner? Does it happen when I'm on my own? What's happened in the past for me? And start to kind of dig into what might be happening for you. So if we're thinking about the things in our bodies that can reduce arousal and slam the brakes on for us in sex, loads of the list, particularly on this slide, is physical stuff. And we've talked quite a lot about this in the last webinar, which I think is on YouTube to look at. But if there's any questions about this after the slides, I'm very happy to talk about it. But anything in your body that might reduce the blood flow or the nerve supply to an area that you want to involve in sex can impact your sexual arousal, and it can put the brakes on. Menopause does this lots. It changes how we receive touch. We get less sensitive in our clitoral tissues, in the vaginal and vulval tissues, if we don't do something to replace estrogen in that area. It impacts the amount of blood that gets sent to the pelvis. We take about a third of our blood supply stops going to the pelvis when we go through menopause. If we don't use HRT, same thing happens in breasts. We get about a third less blood supply to our breasts and nipples. So if those are things that you enjoy being touched in sex, that can start to feel more difficult. And so if we are getting painful sensations, or if we start to sort of notice that our body isn't responding as normal, all of these things mean that your foot's coming off that sort of turn on accelerator and it's going on to the brakes. Our brains, which is what we're sort of focusing on tonight, are one of our biggest parts of our sexual response and our sexual arousal cycles. And our brains are really good at slamming the brakes on in sex for us. And it's because anxiety is absolutely designed to stop the sexual response. In fact, we've got two main kind of nervous systems in our body. We've got the sympathetic and the parasympathetic nervous systems, and they're sort of the prehistoric wiring that our body's got to keep us safe. And our fight-flight response is triggered when we're anxious. And the reason that this stops sex for us is because, once upon a time, anxiety wasn't about whether your belly looked all right, about whether you were going to lubricate with sex. Anxiety would have been a predator coming to the cave that you were having sex in. So when we're under threat and anxiety spikes in our bodies, it shuts down, it chemically shuts down lots of the things that have to happen to get us ready for sex. So it stops the blood supply going to the vagina and vulva. It takes your brain and puts its attention where it needs to be. It directs your energy to escaping. So anything that stresses us with sex, whether we're worried about whether we're going to respond normally, or we're worried about whether it's going to hurt, we're worried about what we look like and whether we feel sexy, or something's happened and we've got an aversion to an activity that we didn't like last time, all of those things will trigger the release of adrenaline within our body. And adrenaline is so good at stopping the sexual response that doctors use it. There's a condition called priapism, which is a painful and permanent erection of the penis. And it's actually a medical emergency. If it stays for about 3-4 hours, you can get serious sort of damage happening. And our treatment for that still is to inject adrenaline into the penis, because it will shut things down. And I often mention that to people when I say that this is how anxiety can be such a bucket of cold water on sexuality. It doesn't need to be just stresses about what's happening within you. It can also just be being stressed about something that happened at work that day, or an argument with a parent or a child, whether you feel safe within your relationship. All of that stuff is going to turn off sex. And there's also the other stuff, and I've got a big long list here, but other relationship issues. So if you're having sex because it feels like a duty or it's out of obligation, and the innate desire that you once felt has gone away, then that is going to reduce your arousal and put the brakes on. If you're struggling with unresolved impacts of trauma, if you're bored, sex is wired to novelty. There's loads of evidence that tells us that we have a stronger sexual response with a novel or new partner or in a new situation. And many people in long-term relationships have got very good at going from A to B to C, and we can get quite typecast within the relationship. And so that boredom and that sort of sense of knowing what's going to happen and not being particularly interested in what's happening can be one of the reasons that we struggle to get aroused during sex. I'm going to talk about the Coolidge effect in more detail tomorrow night, but it's just this idea that we physically mount a stronger sexual response for a new partner, even if we have access to an existing partner already, which is a major problem for long-term relationships, but it's just the way that we're wired. And we were wired that way because it would have given us a wider spread for our genetics. And men and women are both wired in the same way. But it's something that is worth naming because it becomes a factor in libido in long-term relationships. And there are things you can do about it if you understand that it's normal, and you can take the shame out of that and find ways to sort of work around it. Some people that I speak to in clinic actively dislike their partner. They're not getting their needs met in any other part of the relationship. So finding themselves being asked to have sex or having an initiation of sex actually puts quite a lot of anger or disgust or, a sense of loss of attraction. If you're experiencing bladder or bowel or continence problems, which get more common as we get older, particularly with menopause, there can be a real fear of relaxing and letting go. So lots of things can be impacting and putting the brakes on for people. It's hard to give an exhaustive list because it's as varied as our fingerprints, but they're perhaps some of the commonest themes that I hear. So on the counter of that, if those things are breaks to us, or what can we do to kind of increase the acceleration to put our foot down and or feet down and improve arousal? Well, there are physical things. And again, we talked about this last time because there's obviously some overlap with all of this, but in menopause, it can be really important to consider whether we can give back some of the hormones that we're missing. And the broad comment I usually make is that more women are safe to have it than believe that they're safe to have HRT. And for the majority of women, the benefits of HRT will outweigh the risks. But if you're not somebody that wants to have systemic HRT, the vast majority of women, and really is, apart from women who are actively going through a hormone responsive cancer at the moment, they're the only group of people that might need to think twice about using local hormones. So these are just hormones that go into the vagina and the vulva. Almost everybody else can have those safely, and they can be used lifelong in most people. So just putting back the hormones into those tissues will help a lot with sensation and pain and lubrication. It's important to make sure that if you are going to sort out HRT, that you have an adequate dose so that you're not having hot flushes and being kept awake all night, and that your sleep is of good quality. And we'll talk a bit about sleep shortly. Adding a lubricant is useful for everybody. It increases frictionless sex, it reduces tissue damage, it improves pleasure. Young people benefit from lubricants as well as older people, but I don't know why people are shy about them. They can be incredibly useful in maintaining comfort in sexuality. We talk a bit about sensate and self-focus, and sensate focus is really just a way of saying focusing on sensations. And self-focus is the same thing. And the idea of this, and I'm going to go into more detail about all of these things in a minute, is just the idea of exploring your body really widely, but without a goal, without the focus of having an orgasm. It's about learning and focusing on touch, working out what you like best, how your body may have changed, and doing that in a way that doesn't create anxiety. So we'll talk a bit about how you do that on your own and how you do that in partnership. We try and change what's traditionally thought of as foreplay into being a bigger part of what's going on. There's a book by Karen Gurney, who I love, and she wrote this really nice way of describing it, saying, look, sex is not a 3-course meal that has to go from starter to main course to pudding. It's better thought of as buffet, and you can dip in and just have a snack, or you can stay there and gorge on everything if you want to. But if we can take the pressure off, any cuddle in the kitchen is going to end up with an initiation and a requirement to have penetrative sex, then it allows a lot more freedom in couples who might be feeling tired, or who might have some discomfort, or might have issues with performance, to allow them to get back into intimacy. So change the way you think about what counts as sex. Sometimes you've got to think about how you can intensify sensation, because for men and women in both bodies, sensation gets a little bit less intense as you get older. So men will find that it can take longer to reach climax, just as it can be for us. It can take men longer to recover from an orgasm before they're able to have sex again, and that can be similar in female bodies. So sometimes we have to think about how we're going to intensify the sensation, how we're going to improve the tissues, but also what we're going to do to those tissues so that they respond better. And it's also kind of ramping up what's happening in your brain as well. So if you're happy to explore, thinking about reinvigorating your sexual brain, so looking at erotica, porn is a really controversial subject, but what I will say is that pornography is not all the stuff that you can get for free. There's quite a lot of ethical, female-friendly pornography that exists, feminist pornography, with bodies that are much more wide-ranging that's available. So some people find that that can help as well, but it's not for everybody. Making sure that you're looking after your pelvic floor by doing exercises, not just the continence, but because it strengthens the muscles that give us our orgasm. So doing these kind of things can be really helpful too, and stopping any medications that you might be taking to treat psychological issues related to menopause. So anti-anxiety drugs and anti-depressant medications can do a really good job with depression and anxiety, but they can really impact on our sexual function, and they put the brakes on for lots of us. So again, I can answer questions about those afterwards. And we're going to talk about reducing anxiety, looking at body image issues. Sometimes it's useful to seek counselling or support with your relationship. And again, tomorrow night, we're going to talk about this in more detail, but how to sort of look at relationships, how to communicate problems and sexual wants within a relationship, and other things that you can do. And I love my job because it's really interesting. And about a month ago, for my CPD, so for my sort of continuing professional development, I had to do a 2-hour webinar all about sexual fantasy, which was fascinating. And there's science in all of this. And I think this is relevant for people that might be feeling that they've lost a lot of their interest, or that sex has become something that they're less interested in. And it's important to understand that fantasizing is an incredibly normal part of life for most of us. In studies that have been done, about 98% of us have fantasized about sex. And it's different from dreaming about sex. These are waking daydreams that we will indulge in, and we get less of them as we get older because these are chemically driven to an extent. So part of our ability to fantasize and think about sex comes from the estrogen and the testosterone that's in our brains. So this is something that you can focus on recovering to an extent if you go onto HRT, but it's also something that you can deliberately pay attention to, increasing the time that you spend doing this, if you want to rekindle your libido or find your sexual identity again when you've gone through a period of change, whether that's illness or divorce or going through menopause. So there is a really good book called Tell Me What You Want that talks about all of the studies that have been done on fantasy. But there's evidence that fantasizing yourself and being able to share your fantasies with your partner increases sexual satisfaction scores. And it's probably to do with the fact that you can negotiate this sort of lack of novelty that happens in long-term relationships. It allows us to play around a bit with new ideas, not becoming sexually typecast, and sort of, because novelty brings interest and dopamine and triggers all the chemicals that you need for sex, the more that we can wind that into what we're thinking in our own brains and what we're sharing, the better it gets. And what I found really interesting about the webinar was that the figures of people that are fantasizing peak in women at midlife. So the people who are most actively fantasizing about the most interesting stuff are women between 40 and 49. So, for example, we're more likely to fantasize about multi-partner sex, and also more likely to fantasize about things like BDSM and so on, so sort of the 50 Shades stuff. If you ask people who do they fantasize about, actually it's quite safe. About 90% of us do most of our fantasizing about our current romantic partner, believe it or not. But if you're single, it's your ex that's more likely. Those that are actually fantasizing about, celebrities and porn stars and so on, the numbers are much, much lower. And there are 7 main themes about what people fantasize about. And again, these are the kind of things that can be helpful to sort of explore if you're looking for something that is going to try and help you to get a little bit more interest again. So commonest themes in all the people that he spoke to were multiple partners, BDSM, which is bondage and sadomasochism, but it's just a sort of binding. And as I say, 50 Shades is probably the most accessible route that people have come across it. anything that's novel or new sexual experiences, breaking taboos comes up all the time, whether that's doing something in the wrong place or doing something that you shouldn't with someone you shouldn't. That adds a bit of a spark to lots of people. There is just a place for pure passion, romance, and intimacy. So intensity and anticipation come up a lot with fantasizing, but also experimentation, this ability to be someone different, to act differently, to sort of lose that typecasting comes up again and again with this stuff. So what other simple things can you do that will help you to reconnect? And this is where I'm going to go into a little bit more detail about things to challenge stuff like body image and issues around anxiety. So I find it really hard to say in a nutshell what women are supposed to do to feel better about themselves, because I am also a woman and I've also spent 42 years not feeling like I fit the bill in lots of ways, like most of the women that I speak to. And I think one of the things that comes across to me a lot in clinic, because I don't just see women who are menopausal, I see younger women, is that this follows us all the way through our lives. It's not just something that happens around this point where we start to change and our bodies are aging. Most of us didn't feel brilliant when we were 20, let alone now. And I think there's something to learn from that actually all the way through, the people that have managed to feel confident and to feel happy in their skin are often the ones, in fact, the stats show it, they're the ones that have better sex. It's not correlated to what the body actually looks like. It isn't the case that the people who look like an Instagram influencer have better quality sex. They don't. It's about the comfort that you have within your own skin and your ability to be in your body and to enjoy your body. And to do that without judgment. And lots of women in sex are distracted thinking about what they're not good enough at or how they're not coming up to the mark that they should come up to. And that distraction is one of the biggest things that's going to stop them from being able to be fully immersed in the sexual experience, getting their needs met, communicating what they want. So it's really important for us to kind of tackle this stuff, because the only way out of it really is to tackle our internal relationship with ourselves. And that's really hard. That can take lots and lots of therapy. And most of us don't have access to lots and lots of therapy, but there are things that you can do, I think practical things that you can do that help. So one of the things is to change the language that you use about yourself. I think all of us casually are horrible to ourselves all the time. I read a lovely book that said that, it's like having a serial killer living in your head sometimes, the way that we talk about ourselves or reference ourselves. And actually, it's really important to understand that any of us who've grown up exposed to criticism, one of the natural things that we do is we internalize that criticism and we start to criticize ourselves. So noticing when you're describing yourself in language that is different to how you might describe somebody else who looks like you. If you are awful about your body shape, but you can be really generous about somebody else's, then you're using that sort of internal criticism. And it's really important to start practicing using better language, because when you do that, you will start to grow into that being normal. And it takes practice and it doesn't feel natural at first, but it is something that you can actively work on. It's important to think about, psychologists talk about acting or accepting, so making a decision to either do something about something that's bothering you or to radically learn to accept it as part of who you are, and that all of us are a bunch of imperfect things. And sometimes the hardest thing is actually our own acceptance of ourselves. So I think for many women, social media is really unhelpful. And I've said, I think possibly last week, but I say it quite a lot, that when I hit 40, almost overnight, my Facebook feed changed and started trying to sell me hair thickeners and things that might help my boobs to stay firm and things that might make my skin better. And the algorithms are incredibly clever and they're trying to capitalize on fears and sell you things and make you buy things. So you can actually go in on your social media feeds and you can tell social media what you want to see. And it can be really sensible, because this is, again, that sort of drip, drip, drip all day long of things that make you feel that you're not standing up to the level that you might want to be at. And that translates into how you feel in yourself. And there are studies that evidence this. They evidence it for young people, that they don't like their bodies and that they feel inferior, inadequate. But it also is the same for people in our demographic too. So plan what you expose yourself to. Follow feeds that will make you feel better about yourself. Stop planning to change your body. This is part of acceptance. Stop planning the next diet, planning the next exercise regime. Turn the language around on that too. Make your diet more about nourishing yourself, choosing foods that nourish and reward you and keep you healthy from the inside out. Change your focus on exercise to just moving. Find ways of moving within your body that give you joy, whether that is dancing or Zumba or yoga or cycling or walking. Try to think of it as something that is for you and helps you to be in touch with your body. And again, the figures follow this, that women that exercise on a regular basis have better sex. It's not about the body size. If you correct the data for body size, they still report better sex. And part of it is to do with keeping your body physically healthy. But part of it is that we start to appreciate our bodies better. If they can ride for 20 miles or can walk up a hill, you start to think of your body in a different way with more gratitude. And there's lots and lots of research that shows that we are genuinely our harshest critic. So if you show a photograph of a woman to herself and to her partner, she will consistently rate herself more negatively than our partners. Our partners find us attractive. It's us that tend to find ourselves. It's very hard to find yourself sexy sometimes, and you have to work on this. Anxiety, low mood, stress, and overwhelm. These are things that I think lots of people going through menopause, whatever age you're going through it at, will recognize that the hormonal fluctuations change how our brains work. It makes it very difficult to find the words that you're looking for. It can make you feel rubbish at work, so you lose confidence. Emotions can be all over the place, which again can make us feel like we are unpredictable within relationships. It can make us feel sort of lacking in confidence about how we're going to behave and how we have behaved, and we develop a general anxiety. And anxiety and stress, the reason that we feel them physically in our bodies is because they activate that autonomic nervous system again. So they sort of set off our fight flight, but they do that by releasing chemicals. So cortisol and adrenaline are the chemicals that go around our body in higher quantities when we're feeling stressed and overwhelmed. And surprise, surprise, they're things that mess things up even further. So cortisol displaces and impacts estrogen levels and makes them drop even further. So we know all the way across menopause care that anything that we do that improves women's general well-being, so this is like the yoga and CBT and cold water swimming, anything that helps us to feel calmer helps to improve our menopause symptoms and improve estrogen levels and things. And adrenaline does the same thing. So adrenaline is firing our fight-flight mechanisms, and those fight-flight mechanisms are turning off our sexual systems, making our libido crash, but also making us struggle if we do want to have sex. So we can have general anxiety, but we can also set up cycles of significant anxiety around sex itself. If you've been involved with, intimacy with your partner and it's been painful, then you can become fearful of pain the next time, which can stick the brakes right on your, on your arousal. You're not going to get aroused if you're sort of internally wincing about the fact that it might be painful. But you can also develop vaginismus, which is spasm of the pelvic floor muscles, which means that penetration can become almost impossible. So any previous bad experience during sex can make us develop anxiety around it, which then gets into a vicious cycle, meaning that sex gets even more difficult, often more painful, arousal and climax get almost impossible. And of course, we don't have any libido when it's that negative for us. So what do we do about these things? Well, there are obviously medications, and HRT is the recommended treatment in the NICE guidance for women that are experiencing mood issues relating to menopause, and it can definitely help. But there are physical things, there are tools and techniques that you can use. So paced breathing is one that I haven't embedded it because I tried in a webinar before to embed the video and it just didn't work properly. But if you look up paced breathing on YouTube, it's a technique that's used in CBT for menopause, so cognitive behavioral therapy for menopause. And it's in sort of, if you're looking holistically at how the body works, the brain influences how the body feels, but the body also influences how the brain is feeling. And it's happened to me the other night, actually, I was laid in bed with my heart racing, and I wasn't anxious when I laid there with my heart racing, but because my heart was racing, I started to feel anxious, and then I didn't sleep till about 3 in the morning. And if you put in techniques that physically slow down your breathing, and paced breathing is focusing on reducing your inhalations and exhalations to 6 breaths a minute, so really slowing down your systems, then your brain will monitor what your body's doing, and it will, it's got these prehistoric monitoring systems that will tell it that because you're breathing slowly, that you can't be at any risk, and therefore there isn't anything to be anxious about. And it will reduce and dial down the amount of the chemicals that are driving the anxiety. So you've got this lovely sort of circular mind-body thing. So you can use paced breathing when you have a hot flush. You can use paced breathing when you're feeling anxious. You can use paced breathing during sex if you've got anxiety, or if your brain's racing away, or you've got tension in your pelvic floor muscles that you want to try and help to relax. These are useful tools to practice and bring in when you need them. And there's an evidence base. These are things that have been studied and shown to work. I often tell patients to download the Headspace app if you haven't come across that. And there's loads of other apps that help you to slow down and be mindful. And mindfulness is really just the ability to come out of your head and be in your body. And we're going to talk a little bit about that again shortly. Sleep disturbance, I didn't manage. I tried my paced breathing, it didn't work for me. I think I was hungry in the end, actually. When I had a snack at 2 a.m, I was fine. But fluctuating hormones can really mess up sleep for people. And most menopausal women will experience some disruption in sleep, whether it's the hot flushes directly or whether it's just the inability to switch their brains off and get good quality sleep. And when we're not sleeping, the very last thing we feel like often is having sex. It can be really difficult if someone's initiating sex with you when you're knackered and all you want to do when you get to bed is pass out and catch up on last night. So sorting sleep is quite important to well-being, and then it has that sort of knock-on effect to sexuality. So CBT for menopause helps women to understand that their sleep patterns will adjust themselves naturally when you've got interrupted sleep. Your body is designed to cope even when you're not sleeping very well. So we have different sleep cycles, sort of labeled 1, 2, 3, and 4. This is kind of your REM sleep and your deep and your light sleep. And the deepest restorative sleep that we need occurs naturally at the beginning of the evening. So even if you wake up at 3 a.m. or 4 a.m., you will have had the majority of the sleep that you need to help you to recover and refresh from the day before. And if you get more sleep deprived, the speed that you enter deep sleep and the amount of deep sleep that you will naturally take kind of elongates in order to make up for some of what you've been missing. So one of the key things that we're supposed to do to try and improve sleep for people from a behavioural point of view is to encourage confidence that you will cope and to encourage a loss of anxiety, because the biggest thing that stops us sleeping is the anxiety that we're not sleeping. The worry about how rubbish we're going to be the next day turns into a worry as we go to bed that it's going to be another night when we're not going to sleep, and that anxiety fires off the fight flight and makes us not sleep again. So lots of the techniques we use are based around, again, an acceptance, a relaxation, an understanding that you've always coped and you will continue to cope. Your body's very good at getting sleep when it really needs it. And around sleep hygiene. So this is setting yourself regular bedtimes and wake times, avoiding alcohol and caffeine, not reading or watching telly in the bedroom and working in the bedroom, but actually just using it as a place to go to for sleep and for sex. And you might find it useful to make time for intimacy at different times of the day. If it's important within your relationship, some negotiation around when you want to do that. If you're sweating all night with flushes and you don't feel fresh in the morning, discussing that directly with a partner can help. And again, I keep saying it, but HRT directly resolves a lot of these issues by correcting your hormones. Melatonin can be useful for some people too. So a little bit more on performance anxiety and what do you do if you've got to the point where you're fearful about sex or you've become anxious about how it's going to work. So just, I think the top paragraph is really just reiterating that when we're distracted with our worries, when we're full of the chemicals that make us feel anxiety, sex is going to become worse. It's going to be harder to get lubricated than it already was. You're going to get less physical sensation. You know, lots of women feel clitoral numbness and actually as they go through menopause anyway, but that distraction in your brain, that loss of blood supply because your arousal is having the brake shoved down, will just get you into a vicious cycle and make it worse. So what I do in clinic is we start with solo sex. A lot of what you do therapeutically with women is to take the partner anxiety, the need to time your response with somebody else, the need to sort of provide and do what somebody else might need for their pleasure, goes on the side for a bit. And we try to get you to focus on touch on your own. So we nicely call it solo sex, but we get you to build confidence with it. And it's important to do this in a way that encourages the best response. And so that means having enough privacy and focus, and it means preparing for it, getting yourself into whatever context you need to be in order to feel in the right place mentally to focus on what you're about to do. So that might be that you want to have a, very stereotypical, but a nice bath with candles and scented oils and things that get you into a nice place. Work on increasing general physical stimulation. Start with, the non-sexual stuff. Massage your hands because it feels nice. Rub oil onto your arms because of pleasure for pleasure's sake. And the idea with self-focus is not to have an orgasm. It's about mapping your body and also learning to turn your attention onto what's happening in your body and how to bring your brain back. When you get a thought and you drift in a different direction, it's practicing how to bring yourself back into your body. And we normally do that by a scan of your senses. What can I smell? What can I hear? What can I feel? What can I see? Those things bring you directly back in with your senses and back into your body. And that kind of practice really helps with sex especially if you're experiencing problems. And just generally, wouldn't it be nice to be able to do this? But I talk to people a lot about how distraction ruins sex, but I never meet menopausal women who aren't permanently distracted. We're looking after parents, we're looking after children, we're managing the house, we've often got jobs. Our mates are going through difficult times. There's so many things that we're handling. And we're in a culture where doing nothing can feel incredibly lazy. We're not very good at letting ourselves off the hook and resting. But they talk to doctors about this, and I think it's important to talk to you guys about it. You can't help somebody else if your own needs haven't been met. And so you can't be available for someone else's pleasure and enjoyable if you're not meeting those needs yourself. We need to take the word sex out of this conversation and just make it about pleasure. All pleasures, from food, rest, whatever things you enjoy. All of that stuff, in my experience, is stuff that women don't feel particularly good at making time for. So in order to change how you feel about sexuality at this stage of life, we often have to give people permission to meet their own needs first, and all of those needs actually. So there's a study that shows that women who can't orgasm are also really bad at naming other things they find enjoyable physically. So that might be, laying on a beach and enjoying the sensation of heat on your back, or sitting on a swing and enjoying how that feels. It's because most people that are struggling sexually are in their heads and not very much in their bodies. So I often find as well that women are not very good at naming what they want sexually, or understanding, listing in detail the things that they might enjoy. But we're very good at talking about other things that are more socially okay for women to want. So if I asked you to describe your favourite pudding, you could probably give me 5 minutes on the right temperature for the chocolate cake and the sauce that went with it and everything else. But if I asked you to talk to your partner about what you would really want sexually, it can feel more difficult. So I think the key to this sometimes is meeting your own needs, seeing it as an essential part of your week that you make time for yourself for all of the basics. And when I say pleasure for pleasure's sake, I mean spending time eating food that you enjoy, slowing it down and noticing. That might be going for a walk and breathing in the fresh air and looking at the things that you can see and noticing, being in your body, taking pleasure for pleasure's sake. It's really important to practice this, and it can be in any way, in all sorts of different sort of scenarios, different people and different lives. But noticing how to build up sensory sensations within life generally will feed back into being more mindful and enjoying pleasure and sex. And you can do it within your relationship, and we'll talk a bit more about it next time. But slowing down, focusing on lots of forms of sensory touch and contact, not just sex, can help to bring back intimacy in general, really, and bring back focus. So finally, I've got no idea what time it is, but I feel like I've been talking for ages, is a messy chart that I often come back to, which I would explain, which is nicked off Karen Gurney because I think it's beautiful how she describes it. But this is this triangle of conditions for good sex. So this is the idea that you need all the stuff that I've talked about. So you need your sexual function, your sexual body, your relationship in a good position, you're feeling good in yourself. But we also need to layer up which things help us to have the best sexual experiences and use it as a bit of a roadmap to figure out what's going wrong and how to get back to better sexuality for you. And you can do this if you're in a partnered relationship, your partner can do it too, and it can be a basis for conversation. But on the one side of the triangle, we've got all the things that help us to be at our psychological best for sex. These are all the things that we've talked about tonight. How to be turned on in your mind, how to do the things that you enjoy and turn you on sexually, how to be in a relationship that you feel safe in, that you're still attracted to your partner in. You need to have had your needs met potentially. This is different for everybody, but you've got to work out for you what boxes need to be ticked for you to be in the correct context, in the right part of your brain, for you to be turned on and fully in the right place for sex. Physically, it's all about getting the physical stuff right. So with menopause in particular, it's about getting the hormones corrected if that's possible, but certainly about making sure that your body is comfortable and able to feel pleasurable touch. But it's also about working out what kind of touch works for you. You know, what sort of intensity and pressure and temperature? Is it better for you with fingers, with toys, with oils? Working out and expressing this stuff can be incredibly useful. And the key thing that I think often gets forgotten is practicing how to stay mentally present. So in the situations in your life where you have the sexual encounters that you remember as being your best, what was going on that made it like that? What allowed you to stay mentally present and within your body and be totally tuned into what was happening at that time? And what can you do now that's going to help you to put those things on one side and be in the correct context? So that might be planning time away. It might be that you need an entire day's run up for sex where actually you meet all your needs before you're able to do something where you're having to sort of be in that mental space. And I think identifying this and then talking to a partner about how to achieve it can be a really helpful exercise. And then there's the same list of books and apps and self-help things that I mentioned last time. So particularly, I think these are the most useful books that I've come across. Magazine Relate and Cosret and IPM are all places that you can get support for things like cancer or relationship issues. Cosret and the IPM are lists of sex therapists and psychosexual doctors. And as I say, if you're in Hull, then you might have access to someone like me on the NHS. You also work, online. And then we're good for questions. I'm going to stop